We lost someone, but go ahead, Dr. Stroman.
Well, good evening, all you beautiful people from the north, south, east, and west. This is Dr. Stroman. I am so excited to be with two wonderful young ladies that we're going to bring some serious education in a short period of time. A little bit of background about myself. Many years ago, I was involved with the financial industry, former banker, worked in different capacities. And then also at the same time, I was exposed to health and wellness. So the vision came to me that since I had a passion in these two areas, let's turn it into a crusade. So what we did, we formed what we call a dream team of experts. And you're going to hear some wonderful ladies here in a second. And that's when it was born. Because when I look around the world, the concerns that people have, you cannot go a day without somebody's talking about finances or somebody's talking about health. And we understand there's an intersection between both of them. If you have financial challenges, it can affect your health. If you have health challenges, it can affect your finances. And I often say that there's a high economic cost for bad health. Okay. So what I'm going to do right now, and we call it the success triangle. So let me take a second to talk about this. The success triangle is broken this way. At the top is mastering headquarters. And I'm going to deal with that later on in our conversation. The other part of the triangle, at the bottom, you have mastering what I call your $1 billion temple. I will address that as well. The third part is financial power, which is helping to destroy debt, to get that stress off so many people. Since 2015, stress is at an all-time high because of finances. So I believe with what we're doing across the country, and we're getting ready to do some things internationally, if we can get people to buy into this idea of mastering headquarters first, mastering their health and mastering their finances, we can help tremendous amount of people around the world. Okay? I often say that nothing changes until your mind changes. You can change your house, change your clothes, change your car. Nothing changes until your mind changes. So what we're going to do right now, my wonderful friend, that I'm so blessed to be in communication with her and the way God connect me with wonderful people. And I want to introduce you to her because she is an amazing lady, have a lot of love and respect for her. And that's my friend Tracy. She is an amazing lady. So Tracy, I'm going to have you go ahead and share with our listening audience what you bring to the table. And I know you bring a lot to the table, so I'm going to turn it over to you, my dear friend.
Well, thank you, Dr. Stroman. I want to thank you for inviting me. Even though we're using my platform here, I am your guest today. So thank you so much for thinking of me and understanding the importance of what it is that I do. So for those of you that may be watching live or watching the replay, I am Tracy Allen. I am a pre-need cremation advisor here in San Diego, California. And a lot of times people are still trying to figure out pre-need. What does that mean? Pre-need, pre-arrange, advanced planning. A lot of times when you're hearing those terms, it means arranging for your final destination. How do you want to leave this world? What kind of memorial service do you want to have? And so two main things that the reason that people do pre-need funeral plans, excuse me, is two things. One is for the decision making. It helps the family with the decision making. So whether you want cremation or traditional burial, that's a decision that should be made now. My mother told me for years that, hey, I don't want family wasting money, with the traditional burial and stuff. Just cremate me when it's my time. So unfortunately, I lost my mom last year. She had dementia. And so just before Thanksgiving, she passed away. Well, there was no question about what she wanted. So nobody had to argue over that. But when you do not have a plan in place, when you have not expressed your wishes, you have people that say, well, I want to do this and I want to do that. But what is your wish? So the decision making is very important to keep family friends, being able to stay in good standing with each other when that decision has already been made, already been planned out. And then the financials. So even though people may have great life insurance, you may even have tons of money, even if you're wealthy, this is something that still should be planned in advance, because when a death occurs, that's when the people that you love the most are now hurting And now they have to deal with shopping. They're having to make that decision. They have to go out. And, I say this: when there's a need, it opens the doors to greed. Because when we are needing something, that's when we pay more for it. That's when people know that we're vulnerable. And so we leave our families more empowered when we are able to go ahead and get this stuff taken care of in advance. And so, like for my daughter and my son, I have, two amazing young adult children. I love them dearly. And I know that when it's time for me to go, it's going to be hard on them. And even though they're financially okay, I just don't want them to have to spend any of their money, even if it's life insurance. I want them to go ahead and use the money for what it's intended to be, to continue to live. And so I don't want them to have to run around trying to shop and figure things out. So again, to take that burden off of the family, it's a powerful thing to go ahead and get your planning done in advance. And so often we're still seeing people out there trying to do GoFundMe's and selling cookies and cupcakes and all of this here stuff. We need to break that. So if the life insurance hasn't come through when a death occurs, you got to wait a little bit before it does hit the accounts and stuff. The funeral homes, they're not waiting for that money. They want the money now. So I have a plan. I made sure that my plan is something that covers me no matter where I go. Like, Dr. Stroman and I were talking about a cruise. If I'm on a cruise and I pass away, I don't want my kids to have to wonder, what in the heck do we do? Where do we start? They know that they'll be able to make one call to the company that I have my plan through, and I'll be able to they'll be able to go ahead and get everything taken care of through that company. That company will assign someone to handle all of the details so that they can go ahead and grieve, breathe and grieve. And so that's that when you do a pre-plan, it cuts down on emotional overspending. It cuts down on unexpected costs. It cuts down on shopping while grieving. And it just allows your family to go ahead and grieve and breathe. And so, really, that's it, Dr. Stroman. That's the core of what it is that I do for pre planning.
That's excellent. I mean, I ditto everything that you said, my dear friend Tracy. And I want to piggyback on something you said. And I do a lot of these different events. And I believe, Tracy, everything is about perspective. When you have the wrong perspective, it'll keep you from moving forward. What Tracy's talking about is critically important. And what I want to help you out with, and I'm going to address this a little later on, stop thinking about, I don't want to think about it. We all know that's going to happen.
Mm-hmm.
So don't make it a big deal. When you make it a big deal in your mind, it puts you in quicksand and it creates what I call fear from moving forward. Okay? So my thing is this. I want you to live a long, Tracy wants you to live a long, healthy life, okay?
Yes.
But in the meantime, we got to make that exit. So where does this fear come from? That's not in your package. You pick that up from the system, the world system. Okay? So we want to tweak the way you're thinking about those things and don't make it a big deal. Okay? Get it done because here's the thing, and I'm going to talk about this a little later on. You have no idea the peace of mind, even when you have family members knowing that, okay, everything is taken care of, the peace of mind you cannot put a dollar price on.
Mm-hmm.
Because if they know if something happens to mommy or daddy, whoever, everything is in place and they're not hitting a panic button. And that's what's
Mm-hmm.
happening in the community across the nation. We're hitting panic buttons, like Tracy said, and I'm glad she said it because I say it all the time. Just GoFundMe. We've made that in our culture a way of life. What's going
Right.
on? Okay? I mean, come on. And then I heard this, Tracy. I used to do a radio show with this Christian station here, and the lady told me, she said, Anthony, you think that's something? She said, gospel artists, a lot of time when they make transition, they got to do a concert, Tracy, to pay for everything. I said,
Yeah.
what?
Mm-hmm.
This doesn't make any sense. So my thing is, I got my new nickname, Tracy, the Equalizer. Okay,
Uh-huh.
because you can be so spiritual about things and don't look at the practical things that Tracy and I are going to share with you today. You got to do the practical things. You can be
Mm-hmm.
all nothing wrong with the spirit deal because I'm in that, but I understand you need to do the practical things. Okay, so we have a lot of people. I work with a lot of churches and bishops, what have you, and I say the same thing to all of them. We have so much emotions, but not enough strategic planning and management.
Mhm.
We have a lot of emotions, but no strategic planning and management. I don't care how excited you get. You got to become a planner. And that's
Mhm.
what Tracy is talking about. Okay, so we have to change and make this shift. Now, no condemnation if you haven't done this before. The beautiful thing about a new day, guess what? You can start today and share what Tracy shared with your family members and friends. We talk about everything else, Tracy. Hey, the latest shopping, I can get me a new dress. I can what? Hello, let's talk
Mhm.
about some life. And I'm
Mhm.
telling you, when I do kitchen table movements, and I'll talk about that at the very end of my conversation, what I do, I get families together and we have a ball. And we just have such a good time and they don't even realize, oh, it's not that bad. Yeah, we made it bad up here. Okay?
Mhm.
That's all it was. We made it bad in our mind. But then when the parents tell me, I have such peace of mind, I can never get tired of hearing that statement. So
Mhm.
what I'm going to
Yeah.
do right now, I'm going to go through my information. My dear friend Tracy, outstanding job as usual. And I know
Well,
you're
thank
going to
you.
give us the contact information at the very end, right?
Right.
So they can reach out to you.
Mhm.
But here we go. My presentation is broken into three simple chapters. Three simple chapters. So if you're able to take notes, take notes because I'm a teacher. I love teaching. So here's the deal. I talked earlier about the success triangle, right? So the first thing we're going to deal with is what I call mind management. Okay? Because that's where the game is played. If you got the wrong thinking process, it will lead in the wrong direction. So here's some principles that I teach. Number one, the lifespan of a thought is determined by how much attention you give it. Think about that second. The
Mhm.
lifespan of a thought is determined by how much attention you give it. Next principle, there's something that I created called DTI. DTI stands for destructive thoughts and ideas. Okay? Destructive thoughts and ideas. VTI is victorious thoughts and ideas. You got to be a mental drill sergeant. The first part of my day, I spend an hour, hour and a half just on headquarters. Okay? But for sake of time, I'm just going to give you a few things. Next thing, the most difficult project in the world is the reconstruction of the human mind. Oh my God, that's difficult. The word of God in Hosea said we perish for lack of knowledge, but Isaiah said we are captive because we have no knowledge. This is why we got this, what I call education empowerment crusade around the country and around the world, because we're simply giving you education. And by the way, this is not a business opportunity presentation. Okay? That's what this is not about. So everybody can relax. Now, here's another principle. Every thought has a life or death component attached to it. Again, every thought. That's why you got to guard your mind. Every thought has a life or death component attached to it. And those that are in the word know it said death and life is in the power of the tongue. Because your thoughts affect you spiritually, physically, psychologically. Oh my God, you got to guard your mind. Mind management. Out of control mind leads to an out of control life. If you look at issues that most people have, and we all had our situation, we understand that. But when you control your thought life, the world is your playground. Okay, it is your playground when you can control your thought life. Now, because the body has limitations, but the mind does not. Now, here's another principle. Knowledge in its proper use wins battles. I didn't say knowledge. I said knowledge in its proper use wins battle. Let me give you an example. I work with a lot of holistic doctors. So a medical doctor has knowledge, but if he's a smoking doctor, he has no wisdom. He has knowledge, but he has no wisdom because he's smoking cigarettes. Okay? So therefore, knowledge in its proper use wins battles. You got to bulletproof your mind, folks. And people who know me, I'm allergic to negative people. That's just the way I am. Because your mind is a weapon. You got to use it for your advantage, or it can be destructive towards you. Now, information does not bring transformation, conversion does. Information. Tracy gave you some information. It doesn't bring transformation, conversion has to happen. For an example, somebody's married, they want to have a kid. Okay? Now, nothing happens until there's conception. You can keep hearing it over and over again, but nothing's going to happen until there's conception. And it's the same example of having a kid. You can go ahead and have intercourse because you want to have a kid, but guess what? Nothing happens until there's conception. So you can get all the information you need. And so I use this example many times. You get information like what Tracy and I are sharing, You're like a rubber band. When you're in the environment, the rubber band stretches. But once you leave the environment, it goes back to its original shape. What you have to do is take control and have something strong enough to override that so you don't go back into your same thinking process. Many of you, maybe you were thinking about, you know what, I'm going to do this GoFund thing. Hopefully, what Tracy shared will turn your mind around today. It ain't no GoFundMe situation. Okay, I'm going to give you some statistics here in a second. Now, the most powerful thing on earth is the will of man. God don't, he's not gonna interfere with that. It's powerful. Nothing changed till your mind changed. So it's powerful. You're in control. That's what I love about this, Tracy. We are in control. That's why 7 days a week, I have no bad days. No matter what's happening around me, I'm in control. And we must understand that you are in control. Have dominion over your thought life. Okay? Now, when you refuse to change, you wind up in chains. Okay? So you gotta change. You gotta change, folks. So what I want to do right now is shift gears. So this is the first chapter, just a little bit of principles about the headquarters, because many of us need to have a total mental transformation to give us the transportation to take us to our destination. But it takes a total mental transformation to get that happen. So that's chapter one. Chapter two is talking about taking care of your $1 billion temple. Oh my God. I've been in health and wellness for like 20 plus years. And I was sharing with my friend Tracy. I just finished doing a church program this morning, and I was dealing with seniors in the church. And I did a master class on brain health. We had a ball. And so let's talk about taking care of your $1 billion temple. And Tracy, one of the challenges that we have with entrepreneurs, and they go after their wealthy place, but they don't go after their healthy place. I got too many friends that are not here on this planet Earth because they chased the wealth and neglected their health. And they're not here anymore. Now, we want you to have both, but don't get it twisted and focus on, I need to make money, make money, make money, and then you destroy your health. It doesn't make any sense to leave this earth 30, 40, 50 years before your time. That doesn't make any sense. You know, I'm going to be saying two words: count the cost and count the benefits as I go through my presentation. Count the cost and count the benefits. So let's talk about taking care of your $1 billion temple. The way I teach is this. I do a class every Tuesday about this. I teach the power of prevention. If you notice, everything is about treatment, treatment, nothing wrong with that. But we started a prevention movement. You know, why do we have to wait for the diabetes, the cancer, all of this stuff? Most of it can be prevented if they adopt the mentality of prevention. And that's where I'm at. And that's why I'm teaching so many people around the country, adopt the prevention mentality. You got to take care of your $1 billion temple. And I call it that because that's exactly what it is. If you look at your body worth 25 cents, you're going to treat it that way. And that's the problem. You devalue your temple. So when I'm looking at my body as $1 billion temple, now moderation is the key. You don't have to be in bondage. You don't have to be perfect. Okay? But moderation is the key. So let's talk about your immune system. Since that's a popular word today, well, I'm dealing with two different ways. Your spiritual immune system. Okay? I'm going to deal with that first. Those that in the word, Galatians 5:22 and 23, called the fruit of the Spirit. You can read it for yourself. But I believe in studying the word, praying, worshiping, confessing the word, meditating on the word. See, I confess this stuff every day about my health. I don't wait for anything to happen. I talk to all my organs, my liver, my kidney, my pancreas, immune system, cells. I go through that every single day. That's how powerful the word is. So you want to be your own, what I call Department of Defense. Get that word in you. Okay, so that's your spiritual immune system that you want to build up, right? There's no limit to what the word can do. You can't overdose on the word, okay? But medication, don't let me get started with that. You can't overdose. Now, let me briefly talk about your physical immune system, okay? Now, very quickly, count the cost and count the benefits. There's something called, I call it God's pharmacy with an F, okay? Now, God is the manufacturer of your body. So he knows what your body needs. And what happens is the health industry has hijacked our taste buds. They got food scientists, they got craving experts. They know how to trigger things in your brain that make you addictive. The biggest addiction in the world is food addiction, okay? But they're good at what they do. And they take a principle, faith come by hearing, right? They're taking that, Bad things can come by hearing because look at it, we're bombarded with all this stuff. If you don't guard your mind, you're going to be victimized by the system. Now, watch this. Here's what you want to do to protect your physical immune system. So count the benefits. You need to have oxygen every day. Folks, I was telling the seniors from this church that you need to have a breathing exercise every day because you sleep at night, all that stale air is in your lungs. You need to have some breathing exercises. Obviously, you need to exercise every single day. We know that. One of the greatest stress busters and help to deal with mental health and inflammation is exercise every day. I don't care if it's 30 minutes 3 times a day. Do something. We all know the importance of sleep, right? I'll give you a little tip. Don't watch no negative news before you go to bed. Don't do that. All that crazy stuff, it will disturb your mind. Love is really good for your health. Community is good for your health. Having a purpose in life. Don't just get out of the bed as like an accident. Have a purpose. Have an agenda. Okay. And again, toxic people. Folks, I don't care. My family know. When I get around my family, they know. We can talk about, okay, you bring out the obituaries and we talk about that stuff for a while, but I'm not spending 4 hours talking about that. And they know it. I'll walk out the room if they spend too much time on that. And they know me. But here's the deal. You got to reduce the stress, folks. Forgiveness. Even John Hopkins, they talked about the science of forgiveness. You have no idea how powerful that is to your health. Because unforgiveness has got millions of people crippled. And it's for yourself, okay? Forgiveness is a powerful thing. Laughter, very good for your health. A merry heart doing good like a medicine. Some people are just too deep, Tracy. They don't even know how to laugh. If they laugh like they gonna crack, their face gonna crack. Man, you better laugh, okay? Music, I dance every day, Tracy, like you do. I dance every day because I enjoy it every day, okay? Sunshine, you know you need vitamin D. And for those that are African Americans, you definitely need the vitamin D because of your skin pigmentation. You need to do something about that because what this current environment with this COVID situation, it was like almost 90% was vitamin D deficient. Got to do something about that, okay? Now, what I've done to take care of myself, and Tracy, you might laugh when I say this. I don't mean any harm, but when I look at my high school buddies, they look like they can be my uncle. I'm and it's not because I'm better than them. I just made a decision a long time ago. I said I want to take care of myself because I understand what happens is when we eat bad food, it is short-term pleasure but long-term pain. Count the benefits. So if I eat this bad stuff right now, we're not thinking about down the road. See, I'm a futuristic thinker. I'm not doing the nursing home and the crippling. I'm not the one. But guess what? Like Tracy said, I got a plan. I can't just pray about that. I got to put principles in place and do it. Now again, no bondage. Guys, it's okay to do that stuff every once in a while, but we do it too much. And you are victimized because you've been conditioned that way. They program you that. And folks, if I had time to break down behind the scenes what the medical and the food industry is doing to you, oh my God, we just don't have time to get in that, Tracy. It'll make you upset to know what they're doing, how they're tricking you. Okay? I might drop 1 or 2 things about that. But here's the other part. What I do, I connected with a company that I get my product from, and it happens to be a Christian company, been around for 28 years. But I drink something, I put this thing in my water, and what it does, it cleans up the bad stuff in the water and alkalize the water. But here's the thing that people might not catch. Many people know about alkalinity, but this is different. Not only the fact that it's alkaline, but it has 70 organic trace minerals. That's the reason why I'm healthy so much. That's why when I go to the doctor at my age, they be tripping because, man, at your age, you ain't no medication. I mean, I had a nurse, she was actually stressing trying to find a code on the computer. It was funny. I said, I'm not the one. Okay? Then I recommend that you take a good probiotic because 70% of the immune system is in the gut, as we know. There's a gut-brain connection. Your microbiome, you better take care of your gut health. So I take a good probiotic. I take something called silver, which is good for my immune system. And also I take something called cardiozyme. Cardiozyme helps prevent heart disease. Say, well, Dr. Stroman, why do you take cardiozyme and you don't have a heart issue? Have you been paying attention? I'm about prevention. That's why I take it. Because I know it's good for inflammation, free radicals. I know it regulates good and bad cholesterol. And it's outstanding because of the algae protect me from heart disease. I don't have no heart issue. But again, folks, I'm about preparation, preventing that stuff. Okay? The other thing that I do is I take something called Berry Balance. Guess what that's for? Blood sugar. What an epidemic of diabetes do we have in our country? Mr. Stroman, do you have diabetes? No. I take it when I want my blood. Listen, prevention. That's my message when I do health seminars. It's about prevention. So you wonder why I take these things because I am not going to be victimized by the system by doing that. Now, watch this. I'm going to shift gears and talk about the bad stuff for a second. And you guys know what it is. I don't have to point anything out, but I got to say it since we're talking about health. These are the things that weaken your immune system. So count the cost and count the benefit. Too much fast food, too much processed food. Tracy, they did a brain scan because I know I work with these doctors, right? They did a brain scan and they showed a picture of people who eat a lot of processed food and a lot of fast food. It will scare you how their brain looks. And this is one of the reasons why we have a whole lot of brain challenges is because of the foods that we eat. Now, I'm only speaking in general terms, no condemnation, because we don't know. But for the most part, we can help alleviate this stuff by not eating too much of the processed food and the fast food. Sodas, diet sodas. Diet sodas are so devastating, Tracy, that many countries won't even allow it in their country. It's against the law because of aspartame that can cause cancer. Listen, again, moderation. If you're into diet sodas, I don't drink none of that stuff. But I'm saying I'm not. Nobody get condemnation over this. I'm just saying you just need to be aware of it. Then you make a decision. I'm just a messenger, okay? But I'm telling you, it's against the law to have some of those sodas. But we in America, we are a profit-driven country. That's what we are. One country said this, Tracy, said that Americans, for the sake of dollar, are poisoning their people. A country said that. I'm not going to name the country, but that's what they said. But if you study the thing, you understand, well, it's like, okay, we get you sick because we make trillions of dollars when you're sick. So the fast food industry gets you sick, then they pass you on to the pharmaceutical industry, and now it's going toward almost $11 trillion simply because we are out of control as a people. That's all it is. Now, what else can affect your immune system? The bad thing, the sugar, guys. You can eat a little, not too much of the sugar. You know what the deal is. Lack of exercise, your environment, your lifestyle. Many people suffer from what I call lifestyle disease. Okay, all right. Unforgiveness, bad for your immune system. Backbiting, bad for your immune system. Jealousy, envy, worry, anxiety, financial stress, which is my wheelhouse, bad for your immune system. Because a bad thought is just as bad as a bad germ. Got to watch your headquarters, okay? Now, I'm going to make a real shift real quick here, but I'll give you one scripture. Proverbs 14:30. A sound heart is the life of the flesh, but envy the rottenness of the bones. Folks, life is too short to be miserable. It's just too short to be miserable, okay? To have art against another person. I am so free, have nothing against anybody. I can't afford this. Now, the last part we're going to talk about is this. And this is a connect with my friend Tracy. And she laid it out. I'm gonna break it down this way. You need to have a master plan. That's what Tracy is talking about. A master plan. Protecting and leaving a legacy. Now, the three things that I want you to take away from this last part is this. We got to get our people in what I call stability, Tracy. We got to get them stable first. Okay. Once we get you stable, then you move into prosperity. After prosperity, then you move into legacy. So that's the flow. Now, when it comes to love insurance, I call it love insurance, Tracy. I teach people you need to have some love insurance. What I'm going to talk about in a second is having a comprehensive estate plan, which I call leaving a love letter. That's on the same flow with my dear friend Tracy. Leaving a love letter. So if you want to leave a letter, you want to leave a love letter. If anybody in your family have a concern about, I don't want to talk about this, Tracy, you ask them the question, would you like for me to take care of you when I'm not here? That'll shut it down. How would you like for me to take care of you when I'm not here? Okay? That will shut it down. Okay?
Love that.
Now, thank you. Now watch this. What does it say? A good man leave a what? An inheritance. Now we can read that in the Bible. It says it sounds cute to read it, but are we doing it, right? And the Bible also says that a man who doesn't take care of themselves, their family, is worse than an infidel. Dr. Stroman didn't say that. That came from the number one health book and the number one financial book, the number one personal development book, which is the Bible. That's the Bible. It's not me. I didn't say it. Okay? So anyway, stability, prosperity, leaving a legacy. Now, what I'm going to do right now is talk about something that's real dear in my heart that I started in 2021 aggressively. And it's connected to Tracy, what she was talking about in this planning deal. You remember, for those who know a little bit about this, you remember in the Bible, Joseph, he had a plan. And let me give you a principle. God has a plan for you, but he does not plan for you. Let me say it again. God has a plan for you, but he does not plan for you. So here's the numbers. I'm going to talk to you briefly, and we're going to end it with this. Why it's important to have a comprehensive estate plan. I got to help you out. Now, 27% of African Americans, I know we have a lot of people on the stream, but I'm talking about African Americans right now because the numbers are really bad. 27% of African Americans have a will. Just 27%. 52%, this is America, do not have love insurance. They call it life insurance, but I call it love insurance. And over 85, close to 90%, do not have a living trust. And the reason why we don't understand what a living trust is, and I get that. And that's why we have in this class to kind of give you some information about that. Now, so let me break this down. When it comes to a will, there's four components. There's a will, and that's only 25%, the living trust, the health power of attorney, and the financial power of attorney. All the financial experts are saying these are the key documents that you need to have. And by the millions, my friend Tracy, we don't have it. So again, you need to change your perspective. Don't make it a big deal. Because you think about leaving here, and I use the word transition. I like that word, Tracy, transition. It will keep you from doing anything. Now, let me break down really quickly what is the difference between a will and a living trust. And let me just say up the front, a living trust in most cases is more powerful than a will. In our community, we know about a will. Even in law school, because I work with these lawyers, and they have a phenomenal program. Even in law school, they were trained will. Well, over the past 10 years, things are changing. Now we have to re-educate, unlearn some things, re-educate ourselves about the power of a living trust. So let me break it down very quickly for you. And this is called a revocable living trust. We call it a pour-over will because the will pulls over into the trust. Now, a will is good for guardianship, right? End of life decisions, Tracy was talking about. It's good for that. But here's the deficiency. What happens with a will? When somebody has a will and they transition, and I want you to take this away from me right now. You got to decide you want to play by the court's playbook or your playbook. That's what you want to take away. Here's the court's playbook. When somebody has a will and they transition, first of all, probate is no joke. It's very expensive, very stressful. It don't give the family closure. We've seen families break up because they didn't have these things in place. It is a nightmare. How many people, families are falling apart because they didn't have something in place? Now, that's why preparation is amazing, Tracy. Just like I talk about health preparation, same thing with this financial area here. When you have a will, everything is frozen. And let me help you out with that. What do I mean by that? You have a will, your bank accounts are frozen. So what? You have a mortgage payment. Guess what? You think the money's not going to the mortgage payment. I hope you caught that. Got a car payment? It's not going there. Utility bills? The money stops. It's frozen. You know what kind of nightmare that can cause in a family? You know how many foreclosures are happening across the country because they don't have a power of attorney? I'll talk about that in a second. Guys, we got to get it together. We're still in the beginning of the first in 2022, so we good. We can end this year strong, right? Just make a decision, right? So it's very expensive. It's a long process, and it's public information. Now let's contrast that with a living trust. No probate. Now let me pause and say this to you. When you go to an attorney, and this is what makes our program so unique. When you go to an attorney and you have somebody has a baby and grandkids and some people get remarried, all these different dynamics that can happen within a family. Well, every time that happens, every time you go back to the attorney, there's a fee, there's a fee, there's a fee, there's a fee. What I love about the law firm we work with, once you get this program, it's for life. One time, you're done for the rest of your life. You can go back 500 times, there's no extra nothing. That's why we do this all across the country. So let's break down the difference. When you have a living trust, you're in control, your playbook, because if you wait for the government to settle your estate, you're not going to be happy with the results. So a living trust, you in control, less expensive, things are not frozen. Hello, okay. Now we have. I'm a single young man. I don't have any kids, but this is my binder with my living trust and everything in there, and I don't have any kids. So all you married folks, what's your excuse? Okay. Now back to this. So it's private, less stressful. House can be sold just like that. All these things can be taken care of. Now, let me give you some things that you need to think about as we wrap up our session for today. Let's destroy some myths. Oh, I got to be old before I have a living trust. That's a myth. I got to be wealthy before I have a living trust. That's a myth. You got a car, that's your estate. Your bank account, that's your estate. You got a house, that's your estate. We have in our mind, Tracy, I got to be a multi-millionaire because that word estate messed them up. Get that out of your mind. Single people think they don't need to have an estate. Do you want the government to do? Come on, guys. So all these myths, get them out of your mind. So let me give you some things very quickly and we'll wrap up. Here's the things to think about. These are aha moments, right? Here we go. Here's the power of planning, which will give you peace of mind. Planning with a purpose. That's what me and Tracy is talking about. Planning with a purpose. You need to know the things you need to discuss with your family so you can alleviate disputes. Who are you going to choose your executor? How about your guardian? Now, sometimes parents have a hard time with these decisions because they think the oldest child should be the one. Not necessarily. You got to use wisdom. Because if you have a daughter who's the second oldest and she's more responsible, she knows how to take care of business, you need to make her. And they don't have to be the same people, but I'm letting you know because our emotions get involved. So if you let your son take over and you know he's irresponsible, it could be a nightmare. And all of a sudden your daughter got to sue your son. You don't want that. So make sure you make wise decisions. That's why when I create the kitchen table, we have these discussions as a family. And so I'm the third party. And so I'm able to say all those things so the family don't have to say it, Tracy. And they're saying, oh man, Dr. Stroman said we need to talk about A, B, C, D. Yes, you need to talk about all those things. So here's a list of some things real quick. Who's going to be the guardian for your children? Who's going to be the backup executive? Who's going to do the financial power of attorney? Okay? Who's going to do that financial power of attorney is serious because if somebody's not right, hello, financial power of attorney. They got your money. They got to handle things for you. It doesn't mean that you transition. Sometimes people go to the hospital for extended period of time. You need to have a financial power of attorney so they can take care of business. Okay? Who's going to handle the health power of attorney is no joke. And I'll tell you a personal story very quickly. See, when somebody go to the hospital, if you have a health power of attorney, they can do what they want to do. Trust me, they can do what they want to do. You need to have somebody, medical records, access to the doctors and the treatment. Let me give you an example. One example, when it comes to cancer, this blows my mind, but that's the system. Cancer loves sugar. Oncologists in these wards, they give patients sugar. They give them something called Ensure that has artificial flavors and sugar. Now, if you be a health advocate, you say, yo, whoa, don't give that to my loved one. But again, we don't know that knowledge, and we just say, okay, Doc, give them that. I've seen it myself, Tracy, ice cream, cookies, because the energy is drained, I understand. And again, guys, I don't mean no harm, but I want you to be aware of this because I personally experienced this stuff myself, okay? So I'm giving you a little insight of what I went through with my wife who transitioned. So I'm telling you from personal experience and nothing I read about, okay? So that's what I'm trying to tell people, that you need to have a health power of attorney. Now we have blended families. Only 35% husband, wife, kids. 35%, 65% non-traditional. We have to do something about these complex social situations. adoptions, okay, blended families. Also, you need to have a side letter. What is a side letter? When you have a will and a living trust, how about the things inside the house? Who's going to get the jewelry? Who's going to get the gold? Who's going to get the artwork? All these things, because folks go fight over the stuff if you don't have it set up. And there's a thing I used to say: if it's in writing, there will be no fighting, Tracy. If it's in writing, there will be no fighting. Documentation beats conversation. If I got a family at a table and everybody's hearing the same thing and we're taking notes and we're recording it, we don't want to hear it. You know who's getting the call. You know who's getting this. There's no confusion. And families are fighting, and God is not the author of confusion. That's why Tracy and I are trying to get you to plan this stuff. We almost there. So the side letter, okay? You got to fund the trust. You got to make sure you put everything in the trust, okay? Here's another thing. When it comes to Medicaid, long-term care. Now, let me give you my definition, my dear friend, of long-term care. Taking care of yourself long-term, okay? But long-term care is real. Is there a nursing home situation, okay? Or is it an in-house situation? Do you have insurance to cover that? Whatever the case may be, you got a plan. But I believe if you take care of yourself, I know people 95, 100 years old, living by themselves, doing great. 100 and something years old, riding bikes. One lady, Tracy, got a college degree at 90 something. So we got to get rid of this age excuse itis. That's what I call it. Age excuse. You hold yourself back. Live life to the fullest. Now, back to this. Now, I'm about to wrap this thing up. One thing that's very important too is that when somebody transitioned, they found out that 1/3 of all life insurance policies are not recovered. Billions of dollars are lost because we can't find anything. We have something called an electronic safety deposit box. You give it to that person, everything is online. Okay? Now, when it comes to long-term care and the Medicaid thing, folks, as I wrap this up, you got to have a strategy because basically they want you to be broke. To get Medicaid, they want you to have $2,000. So you got to have a strategy because they got a look back thing here. You have to have a strategy to put that stuff in place and making sure the government will get your money. I had one gentleman on one of my shows said he lost family lost $700,000 because they didn't have the stuff set up, Tracy. $700,000. So as we wrap this up, the bottom line is this. I want you to master headquarters, start thinking right and receive what Tracy shared with you to think right so you can make these right decisions. Number two, take care of your spiritual and physical immune system because I want you to live life to the fullest. I want you to be a part of the 120 Club. I'm a part of that club, Genesis 6:3, the 120 Club. I don't believe in that minimum thinking, okay? Middle age to me is 80 years old. I don't go by CDC. I don't think like they think, okay? So the last thing is make sure you get your living trust set up, this whole comprehensive estate plan, and get the love letter done. Tracy, do me a favor, my dear friend. You can put my number in the chat. If they ever want to reach me later on the day and have more discussions about this, my number is 678.
Hang on now. Hang on now.
Okay,
I'm
I got you.
gonna put this in the chat. So,
Thank you. Thank you.
Doctor, let me go back here. Doctor Anthony Stroman. All right, get to me.
All right, 678
Mm-hmm.
907
Mm-hmm.
3135. I'm gonna give you one other assignment, Tracy.
All right.
Here's a website if you want to get more information, okay?
Mm-hmm.
www.myuwe.net / the letter A Stroman. I'll repeat it.
Yes.
www.myuwe.net /
Wait. UWE.
yes, ma'am.
Okay.
UWE
Uh-huh.
dot net / the letter A, and my name is Stroman, Stroman.
All right.
All right. Thank you, Tracy.
You got it.
All
You
right.
got it.
Thank you so much, my dear friends. Guys, as we close, I'll say this last statement, and we'll end the session today. I do a lot of different classes, and none of them are business opportunities. But here's the disease. I know we're talking about vaccines a lot. We need a vaccine against excuse-itis and procrastination. Because procrastination is the assassination of your financial destination. You heard what Tracy say? Get with her immediately. immediately, do not delay, and execute. Okay? If you want information from me about what we talked about, you can call me later on this afternoon. Reach out to me. Let's have a conversation. Okay? With that being said, God bless you to live long and to live strong. Thank you, Tracy, my dear friend.
You're welcome. Now, I don't want you to go anywhere. I want you to stand by Dr. Stroman. Let me just say this real quick because I didn't say this before. I am able to help those that would like to do their pre need planning here in California. But the information that I share is for anyone, anywhere, because no matter where you are, you need to make sure that you're looking into the things that I'm talking about and the reasons that I'm talking about this. So I just wanted to put that out there that if you have questions, of course, you're welcome to ask me those questions no matter where you are. But as far as getting a plan set up, I'm not able to help you if you're not here in California. So that's it. Okay. So thank you, Dr. Stroman. I want you to stand by and thank you guys for tuning in. Like I said, whether you're watching live or you watch the replay, get this information. He shared a lot of great nuggets there. So I'm going to go ahead and close us out. And I shall see you on the other side. Hang on, Dr. Stroman. Don't go nowhere. Uh-oh, wait a minute. Wait a minute. It's so hard to say goodbye. All right. And here we go.